Good afternoon and welcome to Virtual Creation Studio here in Charlottetown, Prince Edward Island. We're delighted to have Tami Adams as our guest today, and we're going to be talking about health spending accounts through the National HealthClaim Corporation. Welcome.
Great
to see you.
Nice to see you too, Paul. Thanks for having me.
All the way down from Calgary.
Cowtown.
Cowtown. So Calgary, Alberta, which is great. How's everything in Calgary?
Wonderful. Yeah,
Wonderful.
Wonderful.
So we Atlantic Business Federation has a great relationship with you guys, and we want to expand that and make it available for more people within Prince Edward Island and Nova Scotia and New Brunswick. So health spending accounts, we talked about it before, and we want to expand on that. But let's give a quick, Reader's Digest version of what health spending accounts are from an Alberta girl.
Yeah, absolutely. Well, business owners are looking for ways to offer benefits to themselves, their families, and to employees, but they're also looking for ways that it can be cost effective. And so health spending accounts are a great opportunity and tool that business owners can utilize this by transferring any medical expenses that they have, things like dental, vision, prescription, paramedical coverage, transferring those personal expenses over to their corporation to receive a tax deduction.
And to be available for them and their staff, too.
That's right. Yeah. So a lot of times, anytime a business owner, they have the entrepreneurship to put a business in place, build it up so that they now have staff. The staff is looking for, benefits, and an employer is looking to retain good employees and offer that. And so there's only certain avenues to be able to do that. And in the market space, there's traditional coverage, but it kind of presents itself as a cookie cutter. Everybody has to kind of take the same thing. And as employers are, more and more aware, there's diversity in staffing, younger staff to more mature staff, we'll say. And
when you see my gray hair, that means the more mature
more
staff.
Mature, that's right. But the staffing has, diverse interests. They have diverse expenses. And so an employer nowadays has to be considerate and conscientious of those kinds of things. So a health spending account is a nice way to offer some flexibility and the opportunity for employees to be able to spend those benefit dollars the way they see fit. So rather than having a cookie cutter type traditional program or plan, a health spending account can be a great top-up option to an existing traditional plan, maybe a Blue Cross program or something like that. But it can also be in lieu of, and a health spending account can provide, a good opportunity to just identify and create the ability for employees to utilize benefit dollars towards what they see fit or what they need. So I'll give you an example.
Okay, sure.
So let's say you and I, we're at different times in our certainly in our age and maturity. However, you're done raising your kids. So I still have kids to raise. So you're done with braces and all of that type of thing. So you might be looking for coverage that's maybe more in line with paramedical coverage, maybe vision coverage, that type of thing. But I'm looking for ortho and maybe glasses as well. But those, just even in that diversity in those needs, where you would like to spend those dollars will be very different than where I will for my family. So with a health spending account, the ability for me to take those benefit dollars and spend them all towards my kids' braces is going to be very beneficial for me. Whereas for yourself, you'd like to maybe be able to split some of those dollars up between vision and maybe have the opportunity to spend more than just, say, $250 every 2 years. Maybe you're looking and interested in spending, and covering the full amount of what glasses and prescription sunglasses would cost.
So what's the benefit for the employer to do that?
Great question. So now by doing that, everything that has been spent by the employee is reimbursed back to them as a tax-free benefit. The corporation now funds that and gets to utilize it as a 100% tax deduction. Everything.
Just incredible. We at Atlantic Business Federation, we have it all set up for our people here. Now, we did when you think of some of these accounts, you think, oh my gosh, it's so complicated to get set up, and there's a lot of paperwork. Let's dispel that right off the get-go, because when I set it up believe it or not, I was thinking to myself, this is going to be complicated. So Tami will explain exactly how easy it is. Now, we will put the link below, so if you want to register or whatever, you just click on the link and Tami can guide you through it. But let's talk about the setup.
Yeah, the enrollment process. You're right. Paul, it is very simple and easy. So a business owner, as soon as they're interested in having this enrolled, it's a 5-minute digital enrollment application. Mm-hmm. It's just the basic information that we need to kind of create it. It gets enrolled within 24 hours. And then within that 24 hours, then we can email employees and or the staff or the individual owner with access to the platform. And the platform is, again, easy access.
Extremely
mobile
easy.
app.
Very good.
And we provide instructions right down from being able to create your secure password, telling you and prompting you how to make your first claim, how to coordinate with existing insurance if they've got insurance. And all of that's available right within that. But we also have a 1-800 number, an email, and a support staff, a call center that individuals can phone and get training and one-on-one assistance and help. But it's very quick and easy. And just to your point too, even in terms of claiming, we have the best claiming submission technology in Canada currently. It's an app that you can download on your phone, and it's as easy as taking a quick picture. It's a snapshot, and that's all that it takes. We at National HealthClaim glean all of the information from the receipt, so you don't have to provide provider information, DIN numbers. You don't even have to know what that's all about. You just take a picture, and we'll do the rest.
Wow, it's really incredible. And for Atlantic Business Federation members, for our clients, obviously we're concerned about them, but there's a program in place now that if you get set up, the fees are completely, there's no cost, zero, not a nickel to set up.
That's right. And then the only cost to the employer, the corporation, is based on usage. So again, there's an administration fee, but that fee is just helping to provide to cover the cost of the technology, the adjudication, that type of thing. But otherwise, there's no cost to set it up, and any admin fees that are charged, it's only based on usage.
Wow, that's incredible. So
if you don't use it, Paul, it costs you nothing.
It doesn't cost me anything.
Yeah.
So far, we've been fairly healthy around here, so we haven't had any claims. But that being said, if there are a claim, just put it into the system. They pay it. They send out the claim to the places that need to go, because we have a group plan through Desjardins as well and Blue Cross, so it can go through there. Whatever's left over,
that's right.
They can pay it from there. Mm-hmm. But again, there's a 1-800 number that if you have any questions, they can guide you through it. But the application and the administration part of it for the business owner is extremely user-friendly. And again, if people don't use it, there's no cost, but you can set it up. So employee A, he's got $500 worth of yearly claims for something simple, then they can go in, and employee B might have $10,000 worth of claims, but it can be set up individual. And sometimes the problem with some type of group plans is you're being charged regardless whether you're 25 years old or whether you're 65 years old. We don't want to take away from group plans, but if there's 4 different types of employee, it's kind of a cookie cutter approach that you can design for each employee what you want to put in place for them. So an older employee that's got maybe more experience but might also have more health claims, you can gear up something perfect for that particular person that wouldn't impact the premiums of the 25-year-old.
Yeah. So having a traditional plan in place, to your point, Paul, it's great. It's it's convenient, it's efficient, and it's solid in the sense that it, as an employer, you're doing the right thing. We've just noticed that, though, as things grow and as companies change and as they take on staff, again, the needs and the diversity of that change as well. And so it's nice to have a health spending account to be able to offer a top-up option and or some more flexibility, creating a little bit more of a robust type of plan or program. Again, by doing that without increasing premiums, without seeing renewal increases year over year, the ability to have input an HSA in place really creates some cost containment and stability, because there is no increase year over year. The HSA budget is the budget. So what is set in terms of limit and what is spent is exactly that. And that can be very stable and consistent year over year. That doesn't have to change. That can sort of stay in place. You might have a business owner that, as you were talking about, puts maybe 5 or 10,000 in place for themselves, 500 for a part-time employee, 1,000 for a full-time employee. So that entire budget is, they're looking at 11.5. Year over year, that would be the max budget that would ever need to.
And it's great for the small business owner that has, say, 2 key employees, and you want to design something for those 2 key employees that might be keeping your whole business afloat, and you might not be eligible for kind of a group plan per se because you're too small, or you have a group plan and you want to offer, that the 20% or the 30% that comes out of the person's pocket and roll that into a health spending account. Keep on saying savings account, but health spending account.
Yeah, you got it.
And it's really amazing. And you were saying just earlier that how many companies have enrolled this year?
Yeah, so far up to September, National HealthClaim has onboarded 1,400 new companies and corporations.
Wow.
Last year, we enrolled 900. So the growth in this market space is increasing. What that tells us is that business owners are becoming more aware of the advantage of putting one in place, and more business owners are implementing that and enrolling. So, and again, how many times in a business owner's, business practice are they offered a product that doesn't cost them something, but actually saves them money?
I know.
Very rare, and
Very
that's
rare.
Exactly what a health spending account does.
It's amazing, and those receipts too that might not be covered for through traditional plans, like naturopath, homeopath, massage therapist or chiropractor, or you have to pick up a wheelchair or whatever. You can turn those into claims from a health spending account that you might not be able to through a traditional insurance company. So it really is an amazing product, and we're Atlantic Business Federation. We're so blessed to be able to provide that for our members and have a great relationship that literally does not cost you a nickel if you don't put a claim in. But to get registered, and it's always there. It's always available to those key employees or part-time employees or full-time employees, and it's something that you can introduce without costing you anything. Again, we're going to set up the links down below for enrollment. But if you have any questions, Tami she's amazing. And her father is a client of ours too, Harry Demis. I have to put a plug in for Harry. But but all of our relationship businesses that we have, they've been fully vetted, and we're delighted about the professionalism and the when we set up here in Atlantic Business Federation, it was done in like 5 minutes. It was so easy. I was amazed, because normally you have to go through a ton of paperwork and forms and this and that. And they've at National HealthClaim Corporation made it extremely easy, and Tami made it that much easier. So that's good.
Oh, that's great. I'm glad to hear that too.
So, is there anything else that we want to tell our members, tell our followers?
I just encourage you folks to take an opportunity to dig in a little deeper and find out what health spending accounts are all about, and take advantage of something that can really help you in your business.
Yeah, the tax rules have changed so much to make these things available for businesses, and for every 10 businesses that I talk to, there's probably 9.5 that never even heard about them. So it's worth your while to take a couple of minutes, find the details out, pick up the phone, ask myself or Tami or anybody else a question about what the program is for and what benefits there are for you and your staff and your family, and put these programs into place, and it truly will grow your business, but more importantly, keep those staff members on that, let's face it, you're competing with larger corporations, government facilities and stuff that have these crazy programs in place, and it levels the playing field between big business, big government, and small and medium-sized business. And that's what we're all about, is to make sure that that playing field is level. Never will be 100% level, but if we can get it leveled, then everybody wins. So, Tami, I appreciate you coming down
thanks, Paul.
all the way from
my pleasure.
Alberta, Alberta bound. So, next time you're in Alberta, drop in to see Tami and, go to the Calgary Stampede, have a couple of beer.
Yeah, that's right. I think I'd like to come this way often as well.
Yeah, I think the East Coast is by far better than the West Coast, for sure. Yeah. Well, again, thank you so much.
Paul. Yeah.
And so, like I say, we're going to put all of the links and descriptions and information. We have a page designed at Atlantic Business Federation for all of this, and we'll put my contact information and Tami's contact information there. If there's any questions, feel free to call or text or get in contact us anytime. So, again, thank you.
Thank you.
And safe driving, everybody.